Good afternoon, clinic members. It's Sunday, March 22nd. I'm speaking to you today from the clinic. This is our second update during the coronavirus outbreak. I'm speaking to you today to update you on how we are responding to the virus outbreak and how that impacts our operations here and how we can serve you in this unusual and difficult time that we're all going through together. So in terms of the national and international picture, I think the news is well known to most of you that the cases are increasing and it is likely to get worse before it gets better. I'm sorry to share that news, but in the context of that and the increasing restrictions on movement around society and unnecessary gatherings, we are making our own efforts to reduce transmission between our members and our staff. So you'll notice today that I'm speaking to you without my colleague, Dr. Lipinski here. He'll be separately addressing his patients. We have decided to stagger our time here in the clinic such that if one of us were to become sick, both of us would not be sick at the same time, leaving you without a physician to care for you. Similarly, our nurses, we have sent home to do their work from home. Their ability to answer phones and to serve you will be unimpeded in what they can do while not physically together with you. So during normal working hours, the phones will ring to our nurses. They will handle whatever situations they can handle, and they will contact Dr. Lipinski and myself for further issues as needed, as would normally happen. It's just that we won't be physically together in the same room. Again, with the effort of reducing transmission between the staff and therefore keeping the ability to stay open and serve all of our members without interruption. I'd like to talk to you a little bit about how things went during the first week of phone visits. So this past week, we were only seeing essential visits in the office for things that we could not handle without an in-person visit. I'll give you a couple of examples of things that we saw. My partner sewed up a laceration yesterday morning. I saw a person with chest pain that had significant risk of being a cardiac issue, happily was not. There were other examples as well, but I share those just so you have a sense of what needs to be seen in person, and that we will see those circumstances in person here in the office. Our restrictions on non-essential visits is to prevent people from coming into the office who are not sick and contracting the virus while they're here. As you may know, that's one of the main mechanisms of spread of the illness in other countries and in other places. So we're attempting to restrict that. But I'm happy to report that during week one of phone visits, we were able to conduct a lot of the important business of doctoring over the telephone. And most of those visits lasted as long as they would in person because there was plenty to talk about and follow up on. So we don't want to lose the trail of things that we are following and tracking down and monitoring just because we can't be together physically. And we feel like to a large extent we're able to accomplish that. So for the coming week, we will, if you have a scheduled appointment, we'll be calling you at the time of your scheduled appointment. We understand if you would rather delay that, and you're welcome to call the office and change those appointments. But again, we have found them useful, and I would encourage you to keep those scheduled appointments. I'd like to talk to you a little bit about our personal experience in handling suspected or known cases of COVID-19 here in the clinic. Dr. Lipinski and I have both had examples of people calling with fever and cough and have suspected the illness. How have we handled those cases? All of them have been handled over the phone so far. None of them have risen to the level of severity of illness that people needed to be hospitalized or otherwise treated outside their home. In most of those cases, we have advised people not to pursue testing because of scarcity of testing on one hand, and also because it often does not change management. It is also not in the public's interest for people with the virus to go out and seek medical attention. So we're glad that those have been the cases so far. I have had one instance of a patient that we felt it was best that she be tested. I'm glad to report that there is testing now available in our community. I was able to arrange that on an appointment basis such that the patient did not have to wait in a line, as you might have seen in the news in other communities. Our community, our hospitals are doing a very good job of coordinating and creating places where people can be treated and tested. I will note that the testing center where this patient went said that the turnaround is about 10 days on the test. So again, another reason why we might not always test. By the time the test results come back, we will have had to make all the decisions about treatment without that test result. So in a sense, the test results are principally helpful for maintaining statistics, but they don't necessarily change what we do for the individual. And while testing is not available for everyone, we would rather limit it to situations where people are critically ill or for other compelling reasons we absolutely have to know. I'd like to speak to you next about treatments that are available for prevention and therapy for COVID-19 virus. I'm sure that many of you have read or heard about treatments that are available. Various different therapies have been tried in the different countries where this virus has taken strong hold. I've had questions from our members about whether or not they should be taking those medications, and I'd like to give you our thoughts about that. One, the medications that are under investigation are not harmless medications, such that if there's not a good reason to take them, I would not advise it because they can do harm. A wise colleague of mine said any medicine that's strong enough to help you is strong enough to hurt you, and that is true of these medications. Secondly, a lot of the medications are needed for their already established indications, and unfortunately the reports of their effectiveness for this virus has resulted in a run on those medications that is threatening the supply of the medications for people who are taking it for the already established reasons. And then thirdly, the medications are most important and most needed for those who are most ill. So if you are generally, unless you are in that category, I do not recommend that you take those medications. So what do I recommend? I recommend that you stay healthy, and you'll know these recommendations. They are nothing out of the ordinary of what we recommend to our patients in all situations, to be strong for whatever threat may come to their health. But to reiterate what we have said before, get your rest, sleep, eat well, exercise, maintain a routine in your life that builds and promotes health. And in this specific time, also all the precautions that you are aware of in terms of not going unnecessarily into public spaces, not gathering, the social distancing that is known, washing your hands if you have been out in public, not going out if you are sick, and not going unnecessarily to visit those who are ill. Those are all the ways that I encourage you to stay well, but at this time, I'm not recommending that you take additional medications. I'd like to end by saying what is good, what good things have we seen in the midst of all this. When a big threat like this comes, the good that tends to come of it is the generosity of spirit that is shown in people seeking to help and to do good in the midst of a difficult time. In our own specific community, I've been very heartened by the outreach from many of our members, some of whom have brought us masks and other protective equipment. Others have offered their clinical help, those with a background in medical fields. Many of you have offered help, and others of you have just called and wished us well. We're grateful for all those offerings to us, and we are heartened by other acts of kindness from one to another outside of our community as well. So I encourage you to look out for the interests of others around you, and also to protect the people around you by keeping yourselves apart and reaching out more in heart and word than in hand. As we look forward to this coming week, we will look forward to our phone conversations and fewer inpatient visits, and we will again update you next week about our plans as this evolves on a week-to-week basis of planning. Thank you, and stay well.